So, all right. Good afternoon, everyone. Thank you so much for joining us for this month's Teach Educational Rounds. Here with us today, we have our very own Myra Fahim, who will be presenting on adapting behavioral treatment for youth. Before I hand it off to her, I'm just going to go through a few housekeeping slides. So if you're interested in receiving a letter of completion for this Teach Educational Rounds, please make sure you have completed the pre-learning assessment and registered for the webinar. As well, please make sure you're signed into the webinar using your full first name and last name so we can track your participation. And finally, please make sure to complete the evaluation and post-learning assessment. That will be emailed to you by the end of tomorrow, and you'll have 1 week to complete that. Please note that a copy of today's presentation slides will be sent along with the recording this afternoon as well. So here is a little bit more information on our presenter today. Myra holds a honors Bachelor of Science from U of T and a Bachelor of Education from Queen's University. Additionally, she holds a Master's of Science in Psychology and a Master's of Social Work. She is registered with both the Ontario College of Teachers as well as the Ontario College of Social Workers and Social Service Workers. She possesses additional certifications in smoking cessation interventions, applied suicide intervention skills training, and adult online learning. She has worked in the field of nicotine dependence for over 10 years in a variety of roles and is currently a manager within our nicotine dependence service. She has a private clinical practice where she largely supports youth and young adult clients with a variety of challenges, including mood and anxiety disorders and substance use. Myra is also a mental health crisis interventions training facilitator. So we are very fortunate to have her with us today. And here's just a list of her disclosures. So nothing to disclose, and just a bit of information on our disclosures. And please note that the content of Teach Educational Rounds are centered on evidence-based guidelines from the following sources. Nonetheless, these materials, as well as any verbal presentation and discussion, represent only general principles, and they do not remove the need for clinical assessments or treatment plans by healthcare professionals. And please feel welcome to use the chat feature throughout the webinar to post any comments or answer any prompts from the presenter. To do this, you can click on the speech bubble icon in the control panel. And please ensure you select everyone so that all panelists, hosts, and attendees can read and respond to your comments. All content-related questions, however, will be answered at the end of the presentation. So please keep note of anything that comes up, and then you can post them in the chat during our Q&A period for our presenter to answer. So with that, I will leave it to Myra to take it away. Thank you, everyone, and enjoy the webinar.
Thanks, Natalie. So welcome, everybody. Today we're going to be talking a little bit about adapting treatment, behavioral treatment for youth. We'll be using lots of examples related to vaping and smoking cessation, but in general, but I'll also be speaking about kind of adapting and engagement with youth a bit more generally, so that some of those things can be applied not just with substance use, but across the board. So just look at what we hope to achieve during the less than an hour we have today. So we're going to look at engagement strategies when working with youth seeking substance use treatment, but again, it's going to also be a bit more broad, that it's not just with substance use, but it can be applied when working with youth and young adults in general. We're going to look at considerations when implementing cognitive behavioral therapy interventions with youth, so ways that we can kind of tailor CBT so that it fits more with those we're working with, and we'll look at some tools and resources to support behavioral interventions when working with youth. And you can move forward. Okay, so Before I jump in with some of my thoughts and perspectives, I thought it would be great to take a moment to ask those of you on the webinar today, what strategies have you found helpful when trying to engage youth in treatment or in any type of work that you're doing, whether it's community-based or in a hospital? What's worked? What have you found works? And you can feel free to type it along in the chat. Open-ended questions and listening, and actually listening to what they have to say and taking the opportunity to reflect back what we do here so that we make sure we have that mutual understanding. Yes, definitely agree. And maybe I'll throw this in there as well for those who may be sitting there thinking, well, I haven't really found the way that I really want to engage with youth. So what maybe hasn't worked so well? So Susan, you say providing info. Yeah. Sharing, and we'll talk a little bit later about how to provide that information. How can we provide the information and the knowledge and perhaps expertise that we have, and providing real life experience if needed or if appropriate. And we'll also talk a little bit about that when we talk about boundaries. So, and also what not knowing sometimes the best way to reach out to truly help. So that's something you're feeling challenged by. And Susan, allow them control, really respecting that autonomy is really, it's just at the core of all the work that at least I do and those that I've worked with really appreciate when we're really taking the time to let the youth be in the driver's seat, and we're there to support in speaking their language, which we'll also talk about a little bit later. Great. So please keep putting in some of your thoughts in there, and we'll kind of jump to some of my thoughts around this. So you can put the slide forward now. Okay, so I kind of divided this into two sections. So one, just looking at how do we create that safe space. So it's not just about getting the youth or young adult through the door, but it's how do we keep that engagement throughout treatment? You know, we may be able to get them to step in, but it's so easy to kind of get to a point where you lose that engagement. So what are some things that we can set up at the beginning and then really keep checking in with on an ongoing basis to ensure that we maintain that engagement? So creating that safe space. So safe space can be a few things, looking at physical space. So if we're talking to a client in person, what does that space look like? Are we sitting behind a desk? Are there large objects between us and the client? We really want to make sure that we minimize anything that creates a barrier between us and the client, and that we're at equal eye level. And being mindful of, do we have a wall full of academic certificates? Do we have maybe paintings, pictures, something to break it up so that if a client's looking around, they're not just seeing a whole bunch of very academic things that might reinforce or emphasize that already existing power imbalance that we have as clinicians when we're working with clients. So really considering that. And when COVID hit and we all went virtual, that became even more apparent to consider when I was working with clients, because you only see the upper half and then whatever's on the wall behind us. So if I'm working in a space and all the client sees is my face and my certificates, that might be very intimidating when working with them. So being mindful of what we have in the background, also considering our own space limitations. So, I mean, I have a whole mess of stuff behind me, but just kind of considering what are they looking at and how does that impact the relationship that we build with our clients. Establishing boundaries and building rapport. So that's not just something we do at the beginning, it's something we do in an ongoing manner, but we really want to establish a good foundation when working with clients. So when I say boundaries, I mean speaking transparently with the client about what is therapy going to look like? What is the work that we're going to do going to look like? And revisiting that in an ongoing manner. I find it can be really challenging when you see a young person struggling and you just kind of want to jump in and help in absolutely any way you can, because you think of all the potential. So even just for myself, thinking what are my boundaries for therapy, and how do I communicate that to the client and make sure I stay within it, so I'm not taking late night phone calls or having unscheduled meetings, and we're really trying to create a routine and establish those boundaries with the client. And speaking to those at the outset can really help build that trust and expectations around what the next weeks are going to look like. And that helps to build that rapport. And as we're doing that foundational work, we really want to have that conversation about confidentiality, which is a big thing when working with a young person, because they have a lot of people involved in their life. And while there's no age of consent here in Ontario, so you can see a client as young as 14 and they can consent to treatment on their own, provided they have the capacity to do so, that the worry is, are you going to tell my parents? Can I really be honest with you? What are they going to know? And how can I trust that what we talk about stays within our own, in the confines of our own therapy sessions or behavioral treatment sessions? So having a conversation and explaining what the process is. So we do maintain confidentiality, and will never should divulge the information from our sessions unless you and I have a conversation about it and we agree that that's something we're going to do. So I would never do that without a conversation, with the exceptions and the limitations of confidentiality, which would be if we know that a child's in danger, if the client's at risk of harming themselves or others, or in the situation of a court subpoena where we'd have to hand over those documents. That's kind of the limitation of confidentiality. But even in those situations, I talk to the client about what do I do in that situation? How do I handle it? I had a client who really did not want to talk about their suicidal ideation. They had a plan, and it was a very vivid one. They had no intent to follow through, but really hesitated to divulge because of a past experience with a therapist who, when they divulged that information, or at least this is what she's relaying to me, when they divulged that information, that she said that client or that therapist shared that information with her parents, and her parents obviously reacted as parents would in that kind of situation. They were very upset, and then it just kind of spiraled. So that broke trust. So I talked to the clients and say, barring any very extenuating circumstance, this is how I would proceed if I was worried about your safety. I would have a conversation with you first. We're always working with that theme of kind of empowering and respecting that autonomy, that if I needed to call 911 because I'm worried about risk, the idea is that I would want to try to encourage the client to do that themselves first before I break confidentiality and do it myself, or before I bring in whoever needs to be involved. There are going to be exceptions to that, but letting the client know that this is my process, this is how I'm going to work with you, and we're going to have that open, transparent communication. So that kind of creates that safe foundation. And then we revisit that in an ongoing manner, especially when we experience some of that hesitation, which will happen often, especially if a client has experienced that breaking of trust with the healthcare system before. So you can go to the next slide. Okay, so communication style, and a few individuals kind of brought up some of these points here around how do we converse with youth or young adults, and how do we create that mutual understanding. So as I've said a few times, respecting that autonomy. Youth live in a world where everyone tells them what to do, whether it's at school, whether it's at home, whether it's family, or what have you. People are always telling them what they can and cannot do. They've got lots of boundaries, established boundaries, which there are reasons for them. We have them and it makes sense. And when they come into the space to work with a clinician, it's helpful to let them feel empowered in the work and feel that they are the ones that are guiding the process and we're really there to support. So respecting those decisions, and really making sure that we are being well-rounded in how we respect those decisions and hear clients out. So when we're talking about, you know, vaping and the harms and the risks and smoking and the harms and the risks, that we're not just in a situation where we're telling them all of the harmful things, but we understand that youth are autonomous individuals and they are able to then talk to us about, well, what's good about it? What's not so good about it? And really allowing them to share their own perspectives and giving them that space. And as someone said, truly listening, making sure that we are reflecting back what we hear, because sometimes there will be a misunderstanding. So that reflection doesn't just show the client that we're listening, but it actually is an opportunity for any corrective conversation in case we're misunderstanding what they're saying. So really taking the time to give the clients the opportunity to be in that driver's seat. And then if we have information we want to share, we ask permission. So oftentimes youth do want to hear what we have to say or do want to hear some of our perspectives. But if we start throwing advice and insights and telling them all the things they should and shouldn't be doing, in my experience, a client disengages right away. You're just another adult telling them what to do, and you're not really going to hear them and understand what they're going through. So if there is information to share, saying, would it be okay if I shared with you some of my thoughts around the pros and cons that you just shared? I had some notes that I was taking, mental notes that I was taking. Or would it be okay if I shared with you some information that I have around some of the risks? And let the client answer. 9.9 times out of 10, a client will say, yeah, sure, because they know they can dismiss the information after. But in the event that, in the small chance that the client says, no, I don't want to hear what you have to say, that's okay. We've respected their autonomy. And then in those situations, I say, that's totally fine. Would it be okay if I asked you about this later? Or would it be okay if I thought, if, you know, checked in to see if you changed your mind a bit later? And I've never experienced someone say, no, don't talk to me later either. Because at that point, then we're really looking at a different, maybe we've disengaged in a different way. But most of the time, individuals know that if you ask me later, I can say no again. But giving the permission lets the client feel like we do respect what they want to listen to and what they want to hear. And it empowers them and makes them feel more motivated. Being empathetic and non-judgmental. And I mean, all of these things are important when working with any client. So I'm not saying that if you're not working with a young person or a young adult, you don't do any of these. It's just, these are things that are really important to consider with youth. The permission goes such a long way. And sometimes I find youth are actually surprised when you ask them permission. They're like, oh, I have a choice. Like I can choose not to listen to you if I don't want to, which just makes them feel like, you know what, this person is really listening to me, and all the fluffy stuff or what they may have seen, what they may have perceived to be fluffy stuff at the beginning when I say, you know, like, I'm here to support you. I'm going to really let you kind of be the guide. This is what things are going to look like, that I actually follow through on that. And being empathetic and non-judgmental, again, youth live in a world where they're told what to do. They're told when they're done, when they do something wrong, and often not in an unbiased, neutral way. They're told in a way that they're maybe feeling like they're being judged. So creating that space where it's like, my job isn't to sit here and judge you. My job is to sit here and support you. So we need to be able to have that space, to be able to have that transparent, honest conversation, and have that agreement that you be honest with me and I'll be honest with you. And as long as we keep revisiting that and maintaining that together as a team, we'll be able to achieve what we want to achieve. Especially because youth don't always come to us with the same goals, say, that may have brought them in. So they may be coming in because they're getting pressure from somebody else. And they may have a totally different idea as to why they need to be there. So really being able to engage in that conversation and get a true understanding. And cognitive and age-appropriate language. So what you might talk about with a 14-year-old is going to be very different than what you talk about with, say, a 19-year-old. So really taking the time at the beginning to understand what works for that individual, what's worked in the past for them and what hasn't worked, and really laying that foundation. You know, that you might use simplified language for someone a little bit younger and might use more less simplified language when they're a little bit older. And to note language, someone had said speaking the youth's language. So being really familiar with the jargon of young folks is important. And I always find I kind of have to balance, you know, I understand it. I speak in a way that I can understand, that youth can understand me, and I don't seem very like academic and kind of distanced. But I also know it might not sound as natural if I start using the same language that youth are using. So understanding what's comfortable for me, but also being aware that using very academic language, talking about when I talk about evidence or risks or harms, may not actually be understood or received by youth in the way that we want. So really being understanding that each individual is going to be at a different level. So taking the time to understand what works and what doesn't, and checking in about it. So if you're starting to talk about something, you've asked permission and you share, and you see that eyes glaze over, and you'll notice this whether virtual or not, that the client's not listening anymore, kind of stopping and saying, "Ooh, you know, I think maybe I was talking a bit too much, or maybe I lost you. Let's take a step back and kind of revisit what, you know, and taking a different approach. What did you hear from me? Is there something that didn't make sense? Can I explain differently?" And really taking that time to assess it. I saw a few things come in. So can we use permission also when speaking to our youth for any advice would be ready to share? You mean, are you asking outside of a clinical session? Yeah, I ask for permission always, and I will be very honest, I do it with my 3-year-old. And sometimes when she's feeling really frustrated, I'll say, you know, I have some ideas on what we can do next. Would it be okay if I shared with you some ideas that I have? And she always kind of looks at me a bit confused, and then actually never says no. She's like, okay, and then we'll listen. So I've done it with my 3-year-old at home, and it gives her a sense of autonomy too. So I ask her, and then she can decide. And sometimes she's not, like, maybe she won't be in the mood and doesn't want to hear. And we don't want to start shoving information at someone who's not prepared to listen, and is not in this headspace for it, because then it doesn't go anywhere anyways. Yeah, it can completely change the dynamics in the in that session. It can completely change any tensions. It just kind of helps relax things and really lets that individual know that, like, really, when I said I'm here to respect your autonomy, I actually am. So I just talked for a really long time with a safe space, communication style. I saw some things in the chat about how maybe asking permission may be helpful. Do any of these things feel like they would be really challenging to do in your setting? And I can share that I say all of these things, but it's really hard when you see a young person struggling and you just want to help, and fighting that writing reflex, right? That I just want to correct and get you where I know you should be, or I know where I think you should be, because it's not about us. It's about that individual and what that individual wants out of that time. And certainly there are ways we can work to motivate them, but the first step is making them feel like they are the ones that can make that decision. So any thoughts on potential challenges? Certainly COVID is one of them, working virtually. It's a lot harder to do a lot of these things because you don't have that, you only have, I guess, partial nonverbal communication cues. You don't really know what's going on below, so it's hard. So you have to pay even closer attention to facial expressions and body movements. And yes, Susan, yes, in your mind, you're just like, please listen to me. I know I have the information. I can help. If you just listen to me, I can help. I know it's hard to that voice. It's not a quiet voice either. Sometimes it can be really loud, but really reminding ourselves what we're trying to achieve. And asking that, please listen, what's that about? Is it more about ourselves and our need to want to help someone or that individual? I'm kind of asking that. And sometimes that's helped recalibrate myself when I feel like this is about me feeling antsy because you're not getting to where I think you should be. But that's about me, and that's things that I need to work with, not necessarily what that individual needs. It's so tough. And it will always be tough. Right, we can jump to the next slide. Okay, so looking a little bit about CBT. So cognitive behavioral therapy is essentially evidence-based therapy that's used in substance used when looking at substance use, but also mood disorders. The evidence base is overwhelming, especially with adults, less so with youth, but it's still there. And it really looks at the interplay between our thoughts, behaviors, and emotions, and how what we think affects how we feel, which then may affect how we behave, or it's not unidirectional. It can go in a whole bunch of different ways, but really looking at how those pieces work together. And CBT, the treatment piece of that, is really trying to pull those apart and really understand how each piece influences the other in an effort to address behavior change. So if you jump to the next slide, Natalie. So I won't go into all of the specifics of CBT. I'll just talk a little bit about some things to consider when utilizing a CBT approach with working with youth. I'll talk a little bit about some tools after this, but just some general considerations. I'm going to skip supports first because I want to talk about that one last. But again, going to what I mentioned earlier, cognitively appropriate, really making sure that what we're talking about, what we're using with clients is something that they can really understand. CBT uses a lot of work between sessions with worksheets or homework, which youth do not like it being, at least in my experience, do not like the use of the word homework. So we actually work together to agree on what we're going to call it on the work that they do between sessions. So we have the open conversation saying, this is stuff you'll work on between sessions is, sometimes we call it homework. What do you think about that? And we'll actually have a conversation about the language we use. So it doesn't feel as off-putting if it's something that's, say, triggering for them. So something that's, we give a lot of worksheets in CBT or when utilizing a CBT approach, but does the worksheet itself, is that helpful for the client? I had a client who kind of expressed to me, I get easily distracted. So if you're going to give me worksheets, I don't want to see worksheets with a lot of words on them. It's going to throw me off and it's not going to be helpful. So I kind of learned that I actually asked before I start sharing worksheets near the beginning when we're talking about what we're going to do. I actually asked them, you're going to need to do some work between our sessions. So what's the best way for us to for me to get that to you? Is it, do you like to do things on paper? Are you going to do it on computer? Are you going to do it on your phone? Is an app helpful to you? And really understanding what they prefer. I've had youth prefer to put it in the notes in their phone, prefer to put in an app. I've had youth want to keep a journal because that's helpful to them. So really being able to talk about what's going to work and then adapting what we provide to them based off of that. So one of the tools we're going to discuss a little bit later, like a thought record, I've had it where I've just created my own table in Word to really pare down the number of words in the worksheet so it's not overwhelming for a client. So just kind of considering that when we're providing information. And in COVID, how do we provide that information? Because it's not as easy as handing a sheet to somebody and reviewing it together in session. Virtually, that's really hard to do. So asking like, how are we going to review this? Do you want to email it to me? Do we want to share a screen? Or are we just going to talk through it? Virtual therapy. So as I've been saying, that's become much more popular, and youth, at least the ones I've been working with, actually like having that flexibility to do therapy from the comfort of their own home without having to commute and stuff. So again, considering how do we adapt for that? So those worksheets, how do we engage in that discussion when we're not in the same physical space? So talking about what all of those considerations would be are important. Mobile-based supports, so some youth like apps. Not all of them do actually, but we have the NDS has kind of developed an app version of our My Change Plan booklet that we used to have, like the physical copy of that we gave out to clients in the clinic, and the Quash app, which is developed by the Lung Health Foundation, and that really looks at, so both of them kind of look at, My Change Plan looks at smoking, Quash looks at smoking, vaping, and kind of providing tools and information. I've had clients use a CBT thought diary app, which they found helpful for their tracking. The thing to consider too is when are those individuals going to be recording? Because some schools don't let cell phones with them, right? So we want to consider all those contingencies. Where are clients spending most of their time? Do they have access to be able to track during the day? Because if they're in class and they can't have their phone on them, they're not going to be able to track. And then to ask them to remember at the end of the day, it's not going to work. So really, like, so many considerations, but that's why engaging in that open conversation is really helpful and checking in about it. And just to go to supports, the reason I left this to the end is because it's so important. Young individuals live with usually guardians, so they're not kind of living on their own and independent. So what we do in session needs to be able to have consistency outside of sessions. And if they don't have control over their environment, that's really tough. So working with youth to engage supports. Sometimes those guardians or parents are positive relationships or negative relationships. We don't know unless we ask. So really trying to understand what are the relationships in their lives, what are the positive ones, what are the negative ones, who do we want to engage in these conversations. Getting that permission, that consent to engage others in the conversation makes such a big difference, because if we're working on something in session and then that client goes home and that environment is completely different, it's going to be so much harder to make a change. So for example, if that individual is trying to address their tobacco use and then they go home and they have both parents smoking in the house, that's going to be a lot more challenging for that youth to make a behavior change. So engaging in that discussion and what that treatment and what those steps are going to look like is really important. So that's support, and support doesn't always have to be parents. So if the relationship with the parents is a negative one, who else can we get involved that they consent to? And again, consent first. We get that consent, we agree on what that plan is, and we agree on what we'll talk about as well. So I talk to the client about what will be shared and what we won't share, so that they don't feel like I may go in and kind of share all of their personal details that they're not comfortable sharing. Okay, so you can flip to the next slide. So I'm going to quickly go over some of these tools. There are lots of CBT tools, but some of the ones that I've used with young clients is obviously goal setting. What brings them into the door? Again, if it's pressure, their goal may not be the same as what the person who pressured them into it may want. So really taking the time to think, okay, what do you want to achieve out of this time? I know so-and-so wants X, Y, and Z, but what will be helpful for you, and really understanding that. And again, those worksheets may need to be adapted. Thought record, also called an ABC analysis, sometimes is really trying to identify those triggering situations, feelings, and automatic thoughts. So that like CBT circle that I showed earlier, it's really just the chart version of that. And again, as I mentioned, it can go from really simple to really complex. You can have lots of layers and build layers as they gain skills, but really working with the client to see what works for them, what's going to make it easiest for them to do the exercises. The more complicated we get, or more complicated outside of what's comfortable for them that we get, the more likely we'll disengage. So really checking in about it and then revisiting, especially when homework isn't done. What's the barrier? Because sometimes it is just the format that something's being given in is just not working. Again, the daily diary, if I'm supposed to be tracking things through the day, well, what does that tool look like? Because if I don't have my phone on me, then I can't track easily if I'm relying on an app, for example. So what are the backup plans, and how do we create a situation where a client doesn't feel stuck? And coping skills and triggers, again, what does that look like? Sometimes we have like, maybe it's a card in a wallet that tells you all your different coping strategies you can use. Maybe youth don't love that so much. So oftentimes they create notes in their phone, alerts or anything. But again, what do they have access to during the day and what don't they have access to? So it's a lot of conversation, but really taking the time to do it sets that individual up for success. Okay. So we're going to go into a little bit of a case study for the remainder of the remainder of the webinar, and then we'll jump into questions. So we have Brendan as 18-year-old cis male. Parents are divorced. Brendan lives primarily with his mother, has a good relationship with his father, no siblings. Finishing final year of high school, just passing most courses, so not kind of struggling a little bit. Also working part-time, currently vaping, nicotine, but also vaping or smoking cannabis. Occasionally uses other substances except alcohol because of the family history. And the estimates of how much they're using is really an estimate. This individual does not keep track very much. So you can flip to the next slide. So the reason for coming, pressure from parents to figure out next steps. So Brendan's struggling in school, and parents really want him to figure out where he's going to go. He has some concerns about vaping, does not want to touch cannabis, and has some feelings of anxiety in general. Can't describe them very well, but nothing formally diagnosed, so no medications are being taken. So Brendan comes to sit with you. He's here because his parents pushed him and he just wants to get his parents off of his back. Has some concerns about vaping. Don't talk to me about cannabis. I'm not going to touch. I'm not addicted. I'm not going to touch. I don't want to talk about it. Don't ask me. And sometimes I feel anxious, but I don't really keep track of when I do and what that means. So what are some of the first things you would do when meeting Brendan for the first time? So this is all the information you have so far, which isn't unlike reality when you get really vague answers to a lot of things. You kind of have to work hard to get more clarity. All right. What do you want to talk about today? Good question. Okay, what's your biggest concern? Absolutely. So from what he hopes to achieve. So all of these things coming through, you're all kind of highlighting the fact that I have somewhat of a good amount of information, but the first thing I'm going to do is see what Brendan wants, especially if he's coming in because he's being pressured, which is great. We really do want to see, what do you hope to get out of it? And really understanding, like, how do we make the most out of this time? And typically in sessions, you're going to want to spend some time, doing an intro to what we're going to do today, and then kind of an outro, but also just let's establish, how do we use this time wisely because it's your time, and you want to finish the session feeling like it was valuable for you. Anything else? I mean, that will be my first step as well. I'd also want to spend some time understanding Brendan's relationship with his family. We know that it's not, he doesn't have a distant relationship with his parents, but what's this pressure causing? What kind of tensions is it causing? And then understanding a little bit about some of these concerns once he kind of shares what he wants to work on, getting a little bit of a lay of the land in terms of what life looks like. Okay, do you want to jump to, well, we're going to build on Brendan. Okay, so you ask those great first questions, you establish some rapport, you begin working on it. So we know that Brendan shared that he has some concerns about vaping, is worried that he might, be a bit addicted, wants to kind of look at that a little bit more, but cannot tell you when he uses, how much he uses, what are the worst situations, what are the most triggering situations. Exactly. So asking about what does the day-to-day look like? Right now, he cannot answer that. He does not pay attention to it. He just knows that he doesn't want to keep doing it when he's older. So it doesn't mean he wants to stop right now, but he does not want to do it when he doesn't want to be an adult vaping. So we say, okay, let's try to figure out where we're at. So we spend some time, talking to him about what a thought record looks like, what a daily diary looks like, to kind of track our use. Because how do we know what we want to change if we don't know what we're working with? So we need to kind of establish that foundation. So you talk about what the worksheet should look like. You give the homework to Brendan. He goes home, meets you next week, and you ask, so how did things go? You kind of do your usual intro to the session. You ask, how did the worksheets go? And Brendan says, oh, I didn't get to it. I was really busy. What do you do? And that's all he says. Oh, I was really busy. I just didn't have time. There's some things you can do to figure out what's going on. Because in order for this to work, he's got to do some stuff between sessions. There's no way behavior change will happen just 1 hour a week. Okay, so revisit a better way to track for him. Ask about, so what happened? What were you busy doing? And we can ask that in a not nosy, curious way, but in a curious way. So say, oh, so you had a busy week. Tell me about what happened this week. Tell me a little bit more, because maybe it could be a few things. Maybe Brendan's trying to hint that something happened and he wants to talk about it. Or maybe he's just kind of coming up with any excuse because he didn't get to it. Maybe he forgot. So if he forgot, asking, okay, so it's hard to remember that worksheet. What about the worksheet do you feel like is difficult to kind of remember to do? And try to understand, is it the worksheet? Because if it's the worksheet, let's figure out what's not working and let's find a better way to track. Maybe he thought he can do it on paper and it's just not working. Or maybe something really bad happened and he was so distracted and it's not the time for us to spend talking only about that worksheet. Maybe he wants to talk about what happened. And yeah, so, you were really motivated last week to work on these worksheets. What was challenging? What were some of the barriers? Identify the stressors and triggers. Yeah. What are some other ways you can complete it? What are some other ways we can look at it? Trying to achieve the same goal, but there are different ways we can look at it. Yeah. Practicing. Let's practice doing it together. maybe get the hang of it. Maybe once he knows that it's not too daunting or overwhelming, maybe it'll be easier to do. Yeah, ask permission to discuss and try to avoid why. Why didn't you do it? Why were you so busy? Why aren't you prioritizing this? We want to steer clear from that kind of language. The other consideration too is maybe he's scared to make the change, and tracking is a step towards change and he's worried that he can't do it. So can we look at that self-efficacy? Can we look at what he's feeling challenged by? It may not be, it could be a million different things. So taking the time to explore it, because I've had clients come and say like, I don't want to start this because I feel like once I've started it, I've committed. And then if I don't do it, then I'm failing. Okay, so now we need to talk about explore a little bit about these concerns around failure, because that's going to be a barrier. So sometimes we need to say, okay, well, why don't we pause this for a second and let's explore this a little bit more? Because you're going to start to unpeel layers. And if you keep trying to go down the same trajectory, you might be missing the things that are actually causing that direction to just not go in the way that you plan together. So really taking the time to be flexible, because sometimes we have to pivot and revisit those goals because maybe what we thought was the goal is not actually the goal. Okay. Some other factors you may consider. So we kind of talked a little bit about it. What are some of your stressors? Is there fear of failure? Is the worksheet just not a good worksheet? It's quite possible too. It could be simple or it can be super complicated. Okay, you go on to the next slide. Okay, so some resources, I put some vaping and tobacco specific ones. There was also a Vaping with Youth webinar last month, so if you didn't see it, making sure to go and check that out with Dr. Tulloch and Dr. Rodham. Some information on the Canadian Pediatric Society, some tools and documents that you can use. Just in general, I still use the motivational interviewing with adolescents and young adults all the time. And they actually recently published, so it's 10 years old now, that book. But they recently published the second edition. It was released end of August. So it's on my Christmas wish list. I actually find it really helpful. Apparently they claim that 65% of the content has changed. So feels like it may be worth getting. It has been a really helpful resource for me, at least. And the Center for Clinical Interventions, I just find this website really helpful because they've got worksheets, which can be helpful depending again on cognitive abilities and stuff like that. So they have a bunch of resources, especially when working in a virtual world, when you don't just have your photocopy handouts, right? So you need to find ways to get workable worksheets. And yes, breaking down the goal more instead of focusing on overall change. Breaking it down into digestible pieces, because a goal, if you're talking about, I never want to do this ever again in my life, that first of all is totally not a realistic goal. And it's also super overwhelming. And helping individuals understand that it's not about never being able to do something or never doing something again, because that's not realistic. That's just not how we work as humans. So being able to make those contingencies and understand that there will be times when, if we decide we're never going to vape again, there will be times when we slip and we vape. Maybe a really stressful situation happens, but how do we work with that? How do we create contingencies? It's takes a while for us to get there. And it doesn't mean that once we get there, it'll never happen again. We create the structures best we can to support ourselves. So really reminding individuals of that, especially if you have an individual who has very perfectionistic tendencies. Okay. So I think I did okay for time. I'm very proud of myself. So the next slide is just questions. Does anyone have any questions? I know I did a lot of talking. and hopefully that some of that information was useful. Again, I find it really helpful with clients when most of my clients don't vape nicotine, they don't smoke. But really taking the time to understand that individual, and it doesn't only have to be used with substance use. I find this is like my foundation when working with a young person. And I believe the slides will be, yeah, I see a nod, so yeah, slides will be shared.
Yeah, I'll be sending them by email later today.
Any other questions? So, I mean, as a clinical individual, you don't, I mean, it really depends on what's feasible, right? Like in an environment within a pharmacy, if you're working within, say, a retail pharmacy role, that your interactions may be much more brief and a lot less contained and private, but it is within scope of practice to do smoking cessation interventions, for example, with pharmacists. But you also can facilitate individuals getting support as well if it's not within or if it's not feasible for you to engage in these kinds of conversations or to engage in that kind of formal smoking cessation intervention, that you can ask those questions, open-ended questions, to help connect individuals with support. Yeah. How do we know how to refer? So that really depends on where you're at. And so I would say, depending on where you live and what's around you, you may have to do a bit of a Google search. But CAMH has resources. You can always go to our nicotine dependence clinic website. We have lots of resources there. And that might help as a little bit of a base foundation in terms of referral sources. You can always check your local public health unit. They'll be able to help you as well. And Susan, yeah, these are, I wouldn't even say that you need to be in a clinical situation for these. I use a lot of these with my family at home. Like it's not restricted to just therapy. The things that we talked about in the considerations are things that you might want to keep more at the forefront of your mind when working with youth. But it's not to say an adult wouldn't greatly benefit from their autonomy being respected, for sure. But we just want to have it at the forefront of our mind, especially because when working with youth, we have that instinct to want to just tell them what to do and tell them, like how to fix things, and we just want to be the fixer. So it's helpful to really keep that, again, at the forefront of our minds. Yeah, I would say work with the individual. You'll find what works. And I most certainly wouldn't say that this would only be helpful for youth. It's just important considerations when working with youth. Okay. Thank you. If you have any questions, if you think of them, you can certainly feel free to email me. I'd be happy to respond to any questions.
Yeah, thank you so much, Myra. It was such an engaging and informative webinar. I know I really enjoyed it, and from what I gather from the chat, it seems everyone else did as well. So just before we head out, I want to remind everyone that this webinar has been recorded, and I will be distributing a link to it as well as a copy of the slides to everyone this afternoon. Please feel free to share this with your colleagues. And along with this, I will also be sending out a link to the evaluation and post-learning assessment that must be completed by next Wednesday in order to receive your letter of completion. We also just want to take the time today to let you know about our upcoming webinar on November 24th. That will be on the topic of pregnancy and postpartum, and we hope to see you there. And if you missed, sorry, let me just change the slide. If you missed a portion of today's webinar or would like to see it again or see a previous Teach webinar, an archive list can be found on our website. And for now, thank you all so much for listening today and participating. We hope you all have an amazing rest of your day.
Thanks, everyone. Have a good day.
You too.